Welcome. We are so glad that you're joining us for this latest in our series of compassion-centered spiritual health fellow presentations here at Spiritual Health at Emory Healthcare. And I bring you greetings and welcome on behalf of our whole spiritual health community here at Emory, as well as our Executive Director, Dr. George Grant. And also bring welcome from our collaborators at the Compassion Center of Emory University, particularly Dr. Lobson Tenzanegi and Timothy Harrison, the Associate Director of CBCT. My name is Maureen Shelton, and I'm an ACP educator and Assistant Director of Education here at Emory, as well as the Director of Compassion-Centered Spiritual Health in the division of the Woodruff Health Sciences Center of Emory University. We are thrilled today to have two of our fellows present. Young Ko will be first up and presenting on cultivating the power of shifting perspectives using the enduring capabilities of CBCT skills and the skills of CCSH. So before we begin, we invite Dr. Timothy Park, the Director of Spiritual Health at Emory Johns Creek Hospital, to introduce Young. Tim, you're free to begin whenever you feel ready. Tim, can you hear me? I think we're having a little sound difficulty. Let's see, I'll be right back. All right, I think we're having a little technical difficulties with Dr. Park's feed. So I'll go ahead.
Can you hear me?
Yes, go ahead, please, Dr. Park.
Oh, wow, I made it. I am so delighted that Young is presenting today. I can best describe Young as a blessed companion. He and I journeyed together for the last 5 or 6 years together. Young is a gentle, compassionate, and solid presence to us all. During the pandemic, Young blessed Emory Johns Creek Hospital with unwavering commitment to patient, family, and staff care. As a blessed companion, he consistently carries himself with dignity and professionalism. I am thrilled to announce that Young will be promoted as a full-time spiritual health clinician at Emory Johns Creek Hospital, where he will continue to be a blessed companion to us all. Young, congratulations, and I am so grateful for you and for who you are. Thank you.
Thank you for that introduction, Tim. So, good afternoon to those watching on the webinar, for those here in the room. I'm very thankful that you're here. And if you have any questions, please be sure to put them in the chat, and at the end of the presentation, I'll hope to best answer them as best as I can. So today's presentation is really a culmination of my 2 years as a fellow and working through 60 CCS cases. And just looking through those cases, one of the things that kind of stood out to me was this idea of shifting perspectives. And so I hope today that I'll be able to explain what I mean by shifting perspectives and what does CBCT and CCSH have to do with that. That's the question I hope to shed some light on today. And just give a little context of my placement. As Dr. Park mentioned, I've been serving at Emory Johns Creek Hospital there as a fellow, and it's a hospital that has about 180 beds or so. And during that time, my focus as a fellow has been in critical care and staff support. And here's the outline for today. I'll be speaking to a little bit about CBCT and CCSH for those who are unfamiliar with these things. And I'll be sharing some cases as well, and then there'll be a takeaway at the end. So the first thing I want to talk about is cognitively based compassion training, CBCT. And in brief, CBCT is a research-based protocol that uses multiple contemplative practices to support the well-being of others. CBCT offers.
We're having trouble seeing. I think some people are having trouble seeing the slides, so maybe you just need to share them.
Got it. There we go. Sorry about that.
Okay, thank you.
So just to go back, we can start from here. It's fine. So yeah, talking about cognitively based compassion training, offers a comprehensive method to training compassion that draws on the ancient Lojong tradition of Indo-Tibetism, Buddhism, and is supported by current scientific research in fields such as evolutionary biology, psychology, and neuroscience. The hope of CBCT is really to increase our compassion and resiliency for our well-being. And kind of, I guess, how I think of it as this expanding and deepening our warm-hearted feelings for others. And for me personally, it's taught me that compassion, which we all have, is a skill that can be trained and can be increased. And so that's been such a benefit for me personally. And I have the definition here of compassion, which is the same for CBCT and CCSH, which is so vital to this training. So compassion is a warm-hearted concern that unfolds when we witness the suffering of others and feel motivated to relieve it. I guess an example that for me personally, the way I think of compassion is when we hear a baby crying, oftentimes there's this warm-heartedness and to want to relieve that suffering. So when we hear our baby crying, we have this warm-hearted concern, maybe especially if it's your child, maybe if it's not your own, I don't know. But then when we see that child suffering, we want to relieve it. So that's how I kind of understand compassion, this warm-heartedness, and we want to act on that as best we can to relieve that suffering. So to continue on talking about CBCT, this is kind of the overview of CBCT. I'm not going to talk about each one of these modules, but I wanted to show just the overview of CBCT. And I'll be talking more specifically about modules 2, 3, and 4. But I do use module 1, which is connecting to a moment of nurturance, and module 2, developing stable and clear attention, and module 3, enhancing self-awareness, and along with self-compassion. But what I want you to see is the end goal, which is this building of resilience and this building of compassion for the well-being. And so that's kind of the end goal of CBT, is to expand that compassion for ourselves and for others. And now I'll be talking a little bit about compassion-centered spiritual health. And this is a program that bolsters the well-being, resilience, and compassion of healthcare patients and providers and staff. It's an approach that is drawn from and built off of CBCT, but created more specifically for the healthcare setting. And so there's 4 stages to CCSH, and I'm going to kind of briefly go through each stage as soon as I can. So the first stage is prepare the care responder. how I understand this stage is really to generate a warm-heartedness. And this could be from before going to a patient's room. It could be looking at their chart, just checking to see what's going on. It could be asking a nurse. But for me personally, the way I kind of think of it is as generating this compassion before I encounter a care seeker or go into a consult. And so that's how I use stage 1. And stage 2, which is attuned to the relationship, this is one that I personally feel like has been such a resource for myself. And there's 3 parts to it. The first was the attuned to self. And the idea is that when we're in the room with the care seeker, we are kind of in this co-creation space where we're creating this a moment together, and we bring about our own kind of what's going on inside of us. And so as I attune to myself, I'm listening to, am I feeling distracted, or something that what's being said, is that resonating with me? Is it something that I need to take care of, acknowledge? And so that's the attune to self. And then attune to other is, as I'm listening to the care seeker share, one of the things I want to do is I want to acknowledge, and I want to allow them to share whatever it might be on their heart or their mind. And I try to do that with some openness, some objectivity, and so they can feel that they're being heard. And in that attunement stage, what we're trying to do is create this empathic balance of I carry my own story and they have their own story. And as we're kind of going about this conversation, I'm wanting to attune to myself and not let whatever is going on inside me be louder than what is being said by the care seeker. So it's kind of this balance that's constantly moving back and forth. And in that stage, we can also discern the sources of distress and really hearing what's going on. What is it that's causing their suffering? And the stage 3 is this accessing compassion. And in this stage, it's a fun stage where we can kind of hopefully bring about some relief. And we can also access by utilizing the care seeker's resources. It might be their faith. It may be their attitude or their perspective on things that we can bring to light. But also in this stage, we can bring about a nurturing moment, attuning to that moment, and broader perspectives. And you can access their faith as well. And then the last stage is entrust the care seeker. This stage I feel is part of the ones that I enjoy a lot, is that after our conversation, after our time together, what can we offer? What can I make more visible in this consult? And offer to them that they can have this a moment or whatever resources we talked about, that is always there for them, even when I'm gone. And so that's the 4 stages. And now I kind of want to turn to the zone of well-being, which is we kind of use throughout our time, the CCSH approach. And the zone of well-being, it's also called the resiliency zone, and created by Elaine Miller-Carras. And as you can see in this picture here, there's 2 blue dotted lines, and then there's a yellow line going up and down. When we're in that between those blue lines, we consider that being in our resilient zone, being our zone of well-being. And in that place, we can have different emotions. We can feel happy. We can be maybe even anxious a little bit. Or it could be sad. But we're in this place of we have options, that we still have clarity of perspective and how we see things. And so as long as we're in that place, we're doing okay. But then there might be times when we have this stressful event or some traumatic reminder or something, and it can bump us out of our zone of well-being. And I might say that we might feel emotional dysregulation about that in that moment we are out of our zone and kind of feeling dysregulated emotionally. And What are the things that can bring us back into that zone? And that's kind of what I'll be talking about in cultivating this shifting of perspectives. So how can we get back into our zone of well-being? How can we get more regulated emotionally? So cultivating this shifting of perspectives. Well, in research that I've done and part of CBCT as well, there's a study in 2020 where scientists from Stanford identified 3 emotion regulation strategies, and which correlate to 3 distinct areas of activation in the brain. And in this study, the participants go through a fMRI scanning of the brain, and they are to view these images, negative images, neutral images, and the varying intensity levels. And what they found was that by using these cognitive strategies, which I'll be sharing next, that they were able to control their emotions, and those were shown to be effective in emotion regulation. So what are those strategies? The first is the attention deployment, and which is this ability to shift our attention away from the thing that's causing us distress or unwanted emotional response. I guess how I think about it, I have a little toddler, and they may be crying for something, but to distract them, I may offer something else, and hopefully the hope is that they can be so distracted, put their attention onto the toy that I'm giving them, that they forget about the thing that they're crying about. And that's kind of why I kind of think of attention deployment. Self-distancing is the ability to step back. Oftentimes when we're kind of bumped out of our zone of well-being, we can become entangled in those emotions. And so self-distancing is this idea that we can unentangle ourselves from those emotions and kind of see it from a more objective point of view. The last one is cognitive reappraisal, which is this ability to shift our perspectives on a situation as a means of transforming harmful habits and reinforcing healthier emotional responses. And for me, that might be oftentimes we can see an event that might happen in our lives, and we find that how we interpret that event has such a strong impact on our emotions. And but if we can shift that perspective, then there might be some relief. They may see that same event in a different way, in a different perspective. And so that's cognitive reappraisal. So how does CBCT kind of work together with these cognitive strategies? Well, one is, this is from module 2, developing a stable and clear attention. And I just point out a couple of enduring capabilities, which is one is our placing our attention on an object of focus. And that really correlates to that attentional deployment, which is this idea that we can shift our attention onto something else, that we have this ability, this choice, this option to take and use our minds to focus on something that's more neutral. And that's this developing stable and clear attention. And then this is module 3, enhancing self-awareness. And the enduring capabilities here are noticing patterns of thoughts and emotions in our inner life and distinguishing reality from our projections. And this one really correlates with the self-distancing and the cognitive reappraisal, which is when we become more aware of these habits, these emotional, when we get stressed, as we become more aware of the way we think and how we our emotional responses are, the more we can kind of as we become more aware of those things, the more we can maybe change those things and maybe think about those ways in a different way, or become less entangled in our emotions that we're facing. And so these are the couple of modules that have been a great benefit for myself in thinking through this cultivating shifting perspectives. So now I wanted to share about some case studies and how I've kind of benefited from this cultivating of shifting perspectives using CBCT and CCSH. Well, the first one is I had a care seeker who is upset as they feel it is their fault that their mother is hospitalized. And what happened was I was in the middle of the hallway, and I saw this daughter and mother being transferred into the step down unit, and I could see that she was very upset. And me just being around, I had this compassion for them, and so I spoke with her about what was going on, what was so upsetting, and she had shared that her mother is getting older and she lives in a different state, and she thought, how great would it be if I brought my mom to visit me and we can spend some time together. And so she had all this hopes and expectations of a good time together, really. But unfortunately, what had happened was that the mom had taken a fall and had injured their head, which brought them to the hospital. And what you can see here is what this care seeker, the daughter, said, which is, if only I hadn't brought her out to visit me, then none of this would have happened. They were just happy, just staying where they were. I thought it'd be nice to get them out. Because what I heard later was that the mom she didn't like moving around too much, but she kind of coaxed her to come and visit her. And so this weighed heavily on her, that she got hurt. And so how did I go about using CCSH when I go through the stages? So the first stage is the care responder. Well, like I said, I was in the hallway and I didn't have any notes, or I didn't know their name. And that might happen. And in that moment, I wasn't able to, connect as soon as, to a moment of nurturance or whatnot. But what I was able to do was I was able to take a deep breath and ground myself by just breathing and focusing on that. Because when we're in the hallway, there's a lot of noise, a lot of people, a lot of distractions. And so I just told myself I just need to just take a few deep breaths and really focus in on what's being said, or what's this concern that this care seeker is having. And so that's kind of how I prepared myself and attuned to her. And then the second stage of attuned to the relationship, well, like I said, I didn't know much. So as I was engaging in conversation, I had a lot of distractions. Internally, I had all these questions of what's going on, what are their names, and what brought them here. But learning to kind of quiet those voices and recognizing that I had those questions, I was able to just acknowledge those and let it kind of go away, and refocus my mind to this care seeker and what they were sharing, and really zeroing in on their concern. And that was my way of attuning to them. And in terms of attuning to the other, I knew that they were in some distress about what they had shared about their mom. But what I also heard was that they had a deep love for their mom. And I, in listening to them, I could see the way that they were kind of seeing this event in their lives and how they were being so hard on themselves. And so in this second stage, also, there's this sources of distress. So I'm going to just go here. And what I found in the sources of distress, and maybe you have already kind of catched on, is that they were kind of beating themselves over this situation, this self-inflicted wounds of just ruminating about what had happened, and kept thinking about what if I shouldn't have brought her here, and this feeling of she didn't even want to come, but I brought her. And so you can sense this kind of like this looping of emotional distress and how that was harming her, this way of thinking. And like I said earlier, when we're out of the zone of well-being, our perspective becomes more narrowed. And we tend to do this where we ruminate and where we kind of do these self-inflicted wounds. And she had obviously had this guilt about that. And so in recognizing those things and attuning to that, I was able to, the third stage is accessing compassion. And so one of the things that we do in CCSH after acknowledging her and allowing those emotions to arise and to come and to share, and I was able to, with permission, ask, would it be okay if I shared a different perspective on this situation? And with their permission, I was able to share this question, a very simple question of, what would you say to a friend? In this situation, if you had a friend and this had occurred to them, what would you say to them, if they're in your position? And with this shifting of perspective, I could see on their face, they started to loosen up. Their shoulders started to relax. And they just kind of had this aha moment of, and almost they kind of laughed at themselves soon after this question, just thinking to themselves, I can't believe I'm, being so hard on myself in reality, right? And I could see that they were smiling again. And so with this simple question, they were all able to kind of take them out of that distress that they were feeling. And so how did we move forward? Well, if I think about the cognitive reappraisal, this idea of cognitive appraisal, their interpretation of that event, of their mom being injured and being hospitalized, well, in this, their initial interpretation was, it's my fault, that she had something to do with that. And this guilt of, I should never have brought her here, and that was causing so much harm. But then when I was able to offer this broader perspective of, what if, you had asked a friend, and this, what would you, really tell them? And then they kind of re-looked at this event with more clarity, kind of disentangling themselves from the emotions that they were having, and seeing from this other broader perspective, which is, it was an accident, it wasn't planned for. And in many ways, I had no control over whether my mom fell here or there. That's out of our control. That wasn't part of the plan, right? And so there was this gratitude that they were kind of glad that they were there, actually. And then there was this shift in emotion, which is they had more compassion and kindness towards themselves. And that's part of module 4 and 5 as well, which is understanding that we're not in control, that we are limited in what we can do. And then this kind of gratitude, recognizing that in retrospect, they thought, well, now at least I was with my mom when this happened. What if this had happened when I wasn't here? And so there was this gratitude, and this re-engagement of their faith that they had shared with me later, which is that they recognized that maybe God had planned this or whatnot, and that she was there, at least, that she was with her mom when this happened. And so that brought about a thankfulness. So that's one case. The next case I have is, I have a care seeker who's female in their 40s, who's been hospitalized due to some tenderness in their right side. And they shared that they've been in and out of the hospital since 2018. And as they've been there, they begin to think about how each time they start feeling better, they worry about the next bad thing that's going to occur, the next time they'll be hospitalized, or and so I'm going to go through the CCSH approach again. And in this case, I actually did have some time to prepare myself, and I was able to look at their chart and whatnot. And but one of the things that I have often done before entering a consult is I say this phrase of just like me, which is in module 7. Just this idea that this common humanity, and this idea that just like me, you want to be well, you want to be free from suffering. And I kind of carry that with me before I go to consults, and it helps me generate this compassion for them and for myself, recognizing, just like me, they want to be well, they don't want to be here. And so I say that to myself often. And in stage 2, this tune to relationship, as I was in the room with them and then having this co-creation, attuning to myself as I was listening to the care seeker share about their love for their children, that they were a mother, and I heard their concern that they wanted to be with them, and but also heard as they began to share about thinking about this distress of it's going to happen again. When is it going to happen? I'm so worried about when is the next time going to be, and in that I was attuning to myself because I was hearing that, and I thought there's something that connects with me in that phrase of feeling of when is this next bad thing going to happen? Things are so good right now in my life. There's bound to be something that's going to kind of tear me down. And I can attune to that. I had some relation to that. And I had to learn to kind of just attune to that myself and acknowledge that and able to kind of shift towards focusing back onto the care seeker. And that's where the beauty of CBCT is, where I could come back into focusing, and it might be just a quick taking a breath and refocusing back on the care seeker and listening to their story. And so that's what I was able to do. And that's how I was able to access this compassion and attune to this relationship. And also the sources of distress, listening to them, I was able to hear that this worry in them, this stress and anxiety and fear about really the unknown, this fear of expectation of when am I going to be back here again, and how that would cause so much stress just thinking about that. And so by tuning to that and hearing that distress, I was in stage 3, this accessing compassion. I once again kind of asked, may I offer a different perspective? And they said, yes. And so I said, well, was there a time you felt that you had to expect expectations of more bad events, but it didn't happen, that there was some exception to that rule? And they said, no. And so I was like, oh, okay. So then I had to, reattune to that and recognize, okay, that didn't really work, but I love CCSH and that fact that there's flexibility in that we have flexibility to shift. And so that's what I did. I said, okay, I hear that, I acknowledge that. And so then I asked another question about, well, tell me about, how do you feel now? And they said, oh, well, actually, I feel pretty good. I feel a lot better than I did, and maybe even I felt better than I have in a while. And when I mentioned the present moment of that, I could tell that they were attuning to that. There's something about that present moment reality brought them some sort of safety, and it brought them out of their zone of well, from being high at the zone of well-being to in the zone. And I could tell that they were feeling more calm and more collected, and recognizing that, maybe I do think too much about the future, and that gets me all kind of worked up. So how did we move forward? Well, kind of going back again, which is this. So what was their appraisal of the situation? And maybe some of us who can relate to this is that, when bad things happen, we think, oh, here we go again. I don't want, something else is going to happen probably. And there's this fear, this anticipatory worry that we might have. And that's the way they were interpreting that situation. And so in hearing that, I was able to offer a different perspective, which is the present moment. And they were able to attune to that moment, that something about attuning to that moment really spoke to them. And they were able to recognize, I do tend to think more in the future so much, and I forget about being here in the present moment. And that brought about in the emotional shift about a calm and a comfort to them, that they were able to see that and reflect that. So I do have some takeaways, but before that, I wanted to, because I think there's more time, I wanted to do a reflection, which is, if you don't mind, maybe we can do a couple of minutes to reflect on our own, how we may have experienced some shifts in our perspectives. And so maybe you can take a minute just to read this, which is, when have you experienced your perspective limited due to unexpected events or difficulty? And how did that interpretation of the event impact you negatively? And then what helped broaden your perspective to bring relief? I'll give us just a minute to do that. And if you feel welcome, you can put it in the chat if you wanted to share, but if not, that's okay. But I thought this would be a good exercise for us to think about maybe a time when we've had some events that have kind of stirred the pot within us and took us out of our zone, and how maybe having this broadening of perspectives could help us bring us some relief. I know for me personally, speaking in public is not always my favorite thing, but by recognizing my perspective on that could be very negative, being harsh to myself or whatnot. But then when I changed my perspective towards, well, how about I think of it as I want to share something, something I've learned and something that I feel grateful for, and see it from that perspective instead of this other more harsh judgment towards myself about, I guess, perfectionism, as you could think. And so by doing that, it helps. It helped me kind of think through, oh, I just want to share this knowledge, or share what I've learned these past 2 years. So takeaways. So there are, one of the takeaways is recognizing that when we are out of our zone, that there are more options to us. Oftentimes we can get very stuck in a loop or ruminating on a certain situation. But when we can kind of take a step back or see it in a different light, we recognize that there are more options. There are more choices for us. The second one is this idea of co-creation, that if I didn't have this empathetic listening and balance, I don't think I'd be able to really hear the discerning of the distress, the source of distress. And so I think this stage 2 is such a beautiful stage, and I've learned so much from that by listening to myself and listening to the other. It truly is a skill. And the last one is, our perspectives are powerful sources of regulating our emotion. And that's one thing that I take away from this shifting of perspectives, is that idea that how we perceive certain events in our lives has a powerful impact on our regulating of emotions. And so if we can broaden those, if we can soften them at all, that would be so helpful for us, I believe. And so those are my takeaways. And for more information, you can go to compassion.emory.edu for the CBCT, and you can go to ccsh.edu or emory.edu for more information on CCSH. Hopefully that piques your interest more. And yeah, I wanted to thank Dr. Park, for those at Emory Johns Creek, Elisa for coming, visiting, and for those even at the hospital today that supported me, for my family, and Maureen and Caroline, and even Daryl, and for everyone that's the fellows here. I'm so thankful for this opportunity to be a fellow, and so thank you so much. Any questions?
Right, we're going to give a few on questions here. Thank you so much, Young. That was wonderful. So let's see. I think that did you hide your?
I did.
Okay, that's fine. Okay, great.
check something is in the chat.
Yes, I have got a few questions here on the chat. Thanks, Jean. So one of the questions is, are you incorporating some MBSR techniques in your spiritual care? And if so, do you utilize meditation in your own daily spiritual practice? Maybe talking about the role of meditation.
Sure.
CBCT.
Yeah. I guess personally, I do meditation as part of CBCT, and that has become more of a practice that I have done. And part of the CBC training, we are encouraged to practice, and that's part of the compassion training. And in terms of being with our patients, I don't do it in any formal capacity, but often it's more in an informal way. And it could be just thinking through. Module 1 is the connecting to a nurturing moment, and that's the one that I've used before. And it could just be, is there something that when they're feeling kind of out of the zone, I may offer them, is there something that makes you feel safe? Or I noticed something in the room, maybe a teddy bear is in the room. I noticed you have this teddy bear. You tell me about that. What does that provide for you? And then having them kind of talk about that. That could be a way of, it's not a meditation, but it's a kind of a redirecting of their focus in some ways into something that feels more safe to them. And so those are the ways that I've kind of used meditation.
Are there days that you feel that your energy level or compassion levels is down, that you feel like not providing spiritual care, and how did you handle that?
Yeah, I think, that does happen at times, and that's part of the stage 1, which is attuning to ourselves, which is this recognizing, I don't have it all today. my level's a little bit low, and so I think that's a skill. It's a self-care, and there's also some boundaries there as well, and learning to kind of navigate those things. And so for me personally, there might be days like that, and I try to recharge if I can in the moment, or by just maybe taking maybe a 10-minute break or something like that. But I think through this CBCT training, I know I have felt more resilience towards that, and recognizing that I can, with more skill and practice, to increase that compassion, and recognizing that it's okay, that I don't have it all today. I think, there's a module 4 and 5 we talk about self-compassion, that we're limited. And so I acknowledge that too, that we are limited, and there might be days where I might not have it all. Yeah.
And just to build on the prior question about in CBCT, you mentioned the particular meditations that are offered in compassion training in CBCT. In CBCT, there's both these mindfulness-based practices, present moment, as well as more analytic meditations. And I wonder if there's a particular analytic meditation that helped prepare you to do meaningful reappraisals in your own life that led to Samoha.
Yeah. Yeah, I think for me personally, I think why I chose this topic is I feel like I've benefited it from it quite a bit in terms of kind of module. I don't know if it's not quite analytical, but and really thinking through like kind of module 3, which is this enhancing of awareness, recognizing, just listening to the patterns of my mind, and then in modules 4 and 5, where we get a little bit more analytical and thinking about ways that we can kind of reappraise those things, how we can see these events or interpretations I may have, and see it with more kindness. I think that has been such a benefit. I know personally that there have been times where maybe I was being self-critical of myself, but then recognizing that voice in me, I was able to kind of appraise that again and say, you know what, I'm just doing the best that I can, and that's all I can do. And so that way I can soften some of those perspectives that I might have on myself. Yeah.
Another question, are there situations where the care responder is hesitant to appreciating a perspective that you help them reflect over?
Yeah, I think that really comes down to the attunement and spending time with the other person and recognizing that trying to figure out what would be helpful. And I don't think in all my cases, I don't offer this kind of shifting of perspective necessarily, but there might be times where to offer that is appropriate. And so with that in mind, I think it comes with some skill for sure, but also some discernment and figuring out what would be helpful. And so I think that's really the trick about it, is trying to see what is helpful. And I don't want to bring harm for sure. So what in that moment would bring some relief if possible. And if not, in my second case, they didn't really take to that perspective that I first offered. And so, but recognizing, I thought there was something else. I think another perspective that I could share. And so I think it really depends on that kind of dance, that co-creation we're doing together in the room.
I thought it was so beautiful in that second case where you shifted the perspective to the present moment. That was a great option. Related question, what helps you begin the cognitive appraisal process?
Well, I think it really begins with just listening. And as I listen to their distress, some of the things that we learn in CBCT and CCSH that allow us to there's some things that we can listen for, maybe some interpretation or some loop or that they might be having. And as we can hear those things, we can kind of bring about a broader perspective in offering care. So it could be that maybe there's someone is constantly being hard on themselves. And so I kind of key in on that, and then I might offer a perspective. Oh, it sounds like you're being hard on yourself. Sounds like this is out of your control, really. And that might be a way to kind of reappraise that situation instead of seeing as that somehow it's their fault or whatnot that they're there in the hospital, and seeing as, these are things that are out of your control, out of your hand. And that's a simple way to kind of appraise a situation.
So Dr. George Grant says, our executive director, beautiful presentation. Thank you for clearly providing the efficacious connections. And then another question about how do you speak to how you do assessments, including accessing resources?
Yeah. One of the things that we do in CCSH is the zone of well-being, and I use that quite a bit, which is recognizing are they in the zone? Are they open to connection? Or are they not? Are they resistant to that connection? And so that's one thing I can use, and by kind of assessing that, I can either go in one direction or another, knowing that whether they're in or out of the zone of well-being. And as we're in the conversation, some of the things that may stand up to as I'm listening is for their own resources. And I try to use the resources that are within the care seeker, what they have already at their disposal. Because my view is that, and I think in the CBCT, is that we all have some capacity for resilience, or we have something that we could use for our own well-being. And so if I can highlight that and make that more visible, that's what I would try to do. It's easier to use their resources than try to bring something.
But one more question. How do you manage time and self-care while maintaining compassion for self and others?
I think that's definitely through practice and training, trial and error, of learning our boundaries and learning our limits. And I think as a clinician, everyone has different rhythms to the day. And so I've learned what kind of works for me, what kind of makes me really tired. And so I think that really helps. And recognizing that, we have lunch breaks as well. And so those help to take a break. and I can just tune off for whatever my break is, and so that really helps as well. It also helps having fellow clinicians around and being able to share our burdens and what's been going on. That's such a great source of strength for me.
So we have some comments here, some more comments from one of our educators, C.G. Gim. Thank you for this excellent presentation, Young. A part of it helped me wonder about how self-compassion contributes to courage. I love that. And then another participant said, thank you for the great insights. And Dr. Bridget Paget, another one of our educators and director at Midtown, thank you for such a powerful presentation. I also appreciate your command of topic and welcoming energy and spirit. Any other questions? Thank you so much. Excellent. So we will take a few moments.